So now, if I were to call you to say, this is what I'm suffering from, I don't know if this can help me. What now? Now that I've made that phone call, what is the process?
So Florida didn't make it very simple. It's actually kind of a little bit of a complicated process. But after 3 years of doing this now and practicing at Southern Comfort, we've really simplified it, and we can make it a very comfortable and really straightforward for the patients. So they feel pretty comfortable when they leave. Basically, you have to first have a diagnosis that would qualify. And there's actually 10 listed conditions that the state would say is automatically qualifying. But there's actually an asterisk. Number 11 gives the physician the privilege or the opportunity to say, no, a patient has a chronic condition. It's debilitating, and it's very similar to the other ones. What we do is we would submit extra legal paperwork and research studies to the state to authorize outside of those 10 conditions. But those 10 conditions would be glaucoma, cancer, seizure disorder, ALS or like Lou Gehrig's disease, multiple sclerosis, Crohn's disease, HIV, PTSD, Parkinson's disease, or just any terminal condition. So there's like a set list of conditions, but again, physicians can use outside of that if someone does have chronic pain because of pinched nerves, or if they have anxiety or depression, or a lot of other conditions would qualify based on the Florida statute. So once we have medical records, then we meet with the physician. And when it's an in-person visit, it has to be with an MD or a DO. The law is that it cannot be through telemedicine. It has to be a physical inpatient visit.
Okay.
And what we do then is we educate about the different process, what's the best strategy for use. We help register you with the state. And then there's actually a separate process to finish the ID card, which gets printed by the Department of Health in Florida. So that's a separate process. We put in orders, which are pretty much permissions of what a patient is allowed to purchase at the dispensary, but the state actually expires those after 210 days. So you have to do this process every 7 months with the physician to get recertified almost, and then every 12 months doing it with the state to get an ID card renewed. So what we like to do is just handhold patients. It sounds very complicated, but it's really not that bad if we have someone that can guide you from the moment of gathering records to finishing your state application. And that's generally what we do.